Hi, welcome to Ask Dr. Amy. Today we're doing a quick math lesson. So your kid has a fever. Should you give Tylenol, Motrin? Are they old enough? How much do you give? We're going to do a tutorial today to figure out how to calculate all of that. And pediatrics is math, by the way. Age and weight is everything. Now the reason I decided to make this video is because even though both of these medicines come with instructions on the box of how much to give, it's one of the most often asked questions from parents because the dose actually constantly changes as the kid grows. Here, I'm going to pull up two examples. One is Motrin, one is Tylenol. These are two big brand names of the medicines we're talking about today. And as you can see here, the chart breaks it down by intervals of weight and age. So first of all, it's confusing because they're putting weight with age, which doesn't always work for everybody. Just because you're this age doesn't mean you're in this weight, so which one should we look at? And then secondly, they give you a wide range of the weight. So the point of these charts is to prevent people from giving too much, from overdosing, which is definitely important. But because that range of weight is there, it leads to a lot of underdosing, not giving enough. Because if your kid is on the higher end of that weight range, they're getting the same amount as somebody who weighs almost half as much as they do. So as an example here, for a baby that's 6 to 11 pounds, to get 1.25 mLs. So if we manually calculate this, for an 11-pound child, the dose of 1.25 is actually only 54% of what he or she should get. That's about half. And sure, you can give a smaller dose of these medicines and be underdosed. It doesn't hurt the child, but most of the time it won't bring that fever down or won't do as much for that pain or discomfort as it can. So I think if we're giving medicine, let's give the real dose that will do the job. So even though I find this chart to be a good idea in terms of preventing overdose, I actually think it's way too confusing. Today we're going to learn how to manually calculate it in the same way that your doctor would in the hospital or in the clinic. So as you can see with my two circles here, we're going to talk about two different medicines. The first one, the generic name is called acetaminophen. Here in the US, we call it Tylenol, or that's the brand name. That's the most popular brand name. In South America, it's called paracetamol. And there may be other formulations out there, but just remember to look for acetaminophen. That tells you it's the same medicine as we're going to talk about today. The other one is called Ibuprofen. That's the generic name. And the brand names there include Motrin and Advil are the most popular ones. But just look for the active ingredient. And if it is the same medicine, then it should say Ibuprofen. Now, a little disclaimer here, without knowing your child's medical history, I can't blanketly say that everybody can take these, even though they're both over the counter. So most people who are healthy and don't have other medical problems should be able to take it. But there are a lot of important exceptions. For example, acetaminophen is metabolized by the liver. So if the child has any liver issues or any reason that decreases their ability to metabolize this medicine, then that's not the medicine for them. And over here, an ibuprofen should not be taken by people with certain clotting disorders in their blood, or people with stomach ulcers or kidney issues, as it can make those two worse. So we're talking really mostly about dosing today, but whether or not you should take these, if ever in doubt, ask a pediatrician or doctor who knows his or her specific medical history. So a couple other things, if they have allergies to either medicine, if they take other medications, it's worth asking if they might interact. So that's my little disclaimer about these medicines and really all medicines in general. But if your child is otherwise healthy, normal, has no other medical issues, then most likely he or she can take these. And the most common reason it's used for, both of them, is to treat fever, which is defined as above 38 Celsius, or if you use Fahrenheit, it's 100.4 degrees. So treat the fever if it's symptomatic, which means that it's making them feel crummy, acting sick, not having energy, not sleeping, not drinking. All these are symptoms that you can help by treating the fever. And these medicines also treat pain. So if you're not getting an actual feverish temperature when you measure, but they're acting fussy, you believe they're in pain, or they're saying they're in pain, it's definitely okay to use these medicines to treat that discomfort, even if you don't have documented fever. It might be a good idea to take a temperature beforehand, before you give it, just so you know you're not masking the fever. But the point is, you can use these medicines to treat symptomatic fever or symptoms, and use the medicines to make them feel better so that they can sleep, they can drink and stay hydrated, and it won't take away the underlying reason that they have the fever, but it can help them feel better as they're getting over it. Now, in terms of age of using these medications, we'll be a little bit more specific when we're talking about the two medicines themselves. But the rule here, by and large, is that if your child is under 6 weeks old and they have a fever, take them to the hospital. They're still in that newborn period. Don't treat that fever at home because it can be a symptom of a much bigger problem. So if your kid is under 6 weeks, this video really doesn't apply to him or her yet. And if they have a fever, please take them straight to the hospital. If they're between 6 and 8 weeks, still don't treat the fever at home and not tell anybody. At least call the pediatrician. Depending on your description of how else the baby is acting, maybe you can just treat the fever at home. Or maybe your pediatrician might want to see him or her. So in the 6 to 8 week period, definitely a gray zone. Now, after 8 weeks, they're out of that newborn period, and they will have received their first round of vaccines. So when we think about a kid having fever at that point, our concern level really changes a lot. Oh, this brings up another point. If your child is not vaccinated and has a fever, then also call your doctor because they could be at risk for so many other infections that might need a closer look and more of a workup. So I'm going to put here no vaccines as another sort of exception of just being able to take these fever medications at home. All right, so let's say that your kid is older than 8 weeks, has no other medical issues, or your pediatrician already told you can take these medicines at home. How do we calculate it? The first thing you need to know is how much he or she weighs. And please keep in mind for the rest of this video, when we talk about weight, it's always going to be in kilograms. Kilograms is 1,000 grams. It's the weight measurement used in most of the world, but in the US we use pounds. So the first most important thing is to know the conversion between pounds and kilograms. And that's just a simple number to memorize. It is 2.2. So the number in pounds divided by 2.2 is kilograms. So a quick example here, if your child is 22 pounds, conveniently, let's divide that by 2.2 and the answer is 10. So they're 10 kilograms. And by the time that your child gets to 45 kilograms, this video no longer applies to him or her. At that point, 45 kilograms, or about 100 pounds, they should be on adult dosing for these medicines. So please don't use the formula to calculate if your kid is 60 kilograms. That's going to be way too much. So above 45 kilograms or 100 pounds, give them what you would take. The adult doses would apply. All right, let's start with acetaminophen, Tylenol. Here, I'm going to say that Tylenol you can use when the baby is above 2 months of age. It is safe for newborns much younger than that, but as we talked about before, under 2 months, you really should be in the hospital or at least calling your pediatrician. So I'm going to say at home by yourself, it should be over 2 months. The dose here is 15 milligrams per kilogram, every 6 hours as needed. Alternatively, you can also give 10 milligrams per kilo every 4 hours. And over a 24-hour period, either of these would give them the exact same amount of medicine. So, and this is just my bias, I think if we're giving medicine, like I said before, let's give the real maximum but safe dose so that we can achieve our purposes, especially since we're treating symptoms here. Otherwise, we might as well not give the medicine at all. Now, one thing I want us to pay attention to is milligrams here. Milligrams is the actual amount of medicine, the acetaminophen. Let's think of it as little particles, the actual medicine in this case, our liquid medication. And then ml, milliliters, is a measurement of volume. So this is my flask, if you can use your imagination. The milliliters, the volume, is what you will be measuring out when you're giving the medicine. Therefore, knowing how many milligrams in an ml is very important to know about the medicine. And here, for Tylenol, they did us a favor and tossed out all the different concentrations that there used to be. And as of right now, Tylenol is made in one concentration that has 160 milligrams in every 5 mLs. Now, please look at your bottle though, because there used to be other concentrations. And if you have one, it's probably very old. So first, please make sure it's not expired. And if it's not expired and you still want to use it, then you will have to change the math here. Because the weight helps us determine how many milligrams to give. And then this concentration then tells you how many milliliters to measure out. So let's do a sample calculation here. All right, let's start all the way back and say we don't even know the weight in kilograms. Your kid is 40 pounds. So first, we need to know the weight in kilograms. So 40 divided by 2.2 gives us 18 kilograms. So then 18 kilograms times 15 milligrams every kilo, so 18 times 15 That gives you 270 milligrams. That is one dose. How do you draw up 270 milligrams? You have to know what the concentration is. So if there's 160 in every 5 mLs, then you can calculate how much volume it takes to give you 270, and the answer there is 8.5. Now, we're talking about liquid formulations here because most kids prefer to take the liquid. But if you're giving a solid or a non-liquid form, then your calculation ends at milligrams. You just have to see how many pills or capsules or something makes 270 milligrams. All right, let's come over to ibuprofen, which belongs to a class of drugs called NSAIDs. I'm just putting this here because sometimes doctors will say, oh, you shouldn't take NSAIDs, instead of saying actually ibuprofen. It stands for non-steroidal anti-inflammatory drug. So when in doubt, or if you've had your doctor caution you about NSAIDs, ask before you give. Now, ibuprofen or Motrin Advil is approved for kids older than 6 months. There's not been good studies and evidence to prove the safety of use in kids younger than 6 months. So as a rule, don't use it in kids under 6 months. So that really gets us out of that newborn stage. So the 2 months rule doesn't apply here. And once they are 6 months or older, the dose here is 10 milligrams per kilo every 6 hours. These manufacturers have not yet gone the way of Tylenol, making one concentration for all liquid. There are still different formulations on the market. Most notably are these two. One is 50 milligrams in 1.25, and the other one is 100 milligrams in 5. The first one is called infant, and the other one's called children's. Now again, you can use either of these. There's no difference from the medical perspective. The difference between these two is the concentration and the consistency. But because this difference exists, please pay close attention to the formula you already have. Now let's do a sample calculation with the same weight, but 2 different formulas, and you'll see the difference. All right, we've talked about the pounds and kilos thing enough. Let's just start with 8 kilograms. Your child is 8 kilograms. So 8 times 10 milligrams per every kilo, that gives you 80. So 80 milligrams is your dose. So if you have 50 milligrams per every 1.25 mLs, then to give 80, that's about 2 mLs. Same child, same weight. Let's just do this one more time. 8 kilos times 10 milligrams per kilo is also 80 milligrams. But here, because you have 100 milligrams in 5, then to give 80, you need 4. So the 2 ml and the 4 mLs here give the exact same amount of ibuprofen. You can give either one, but just, again, please look at the concentration. So this is how you calculate the dose for these two. And again, it's not wrong to follow the box, but if you want to make sure that the medicine is not underdosed, this is how I would dose the medicines for otherwise normal, healthy kids. All right, a couple other things to wrap up our topic. These are the 2 popular over-the-counter options for treating fever and pain. And for adults, some people take aspirin, but just keep in mind, aspirin is not approved in kids under 12. So absolutely no aspirin under 12 unless they have Kawasaki's or another reason that the doctor specifically prescribes aspirin. And lastly, it can be confusing that some people talk about using Tylenol and ibuprofen separately and staggering it to give you control for those fevers that just won't respond. And there's some confusion about how to stagger it. Now, these medicines are in 2 different categories. So when I say every 6 hours, I'm talking about between Tylenol and Tylenol, between Motrin and Motrin. But if you want to stagger these, let's look at the easiest ways to keep track. So if this is your timeline, and the white dots here will be acetaminophen. So you're giving a dose every 6 hours. Again, these are only if you need them, but let's say your child needs it every 6 hours. Then an easy way to stagger in both of these is to give ibuprofen at the halfway point between 2 doses of acetaminophen. So if you do it that way, then the interval between 2 doses of the different medicine will be 3 hours each time. Now, this is only easy so you don't have to keep track of 2 different time intervals as you count, but it's really not the only way to stagger them and use it together. So let's look at another example. If you're giving acetaminophen every 6 hours as before, and after the first dose, you decided to give some Motrin, that's perfectly fine. But just make sure that then you keep track of the 6-hour intervals separately for both of them. It's no longer every 3 hours. And you certainly don't have to keep giving both of them just because you started that way. So let's say you gave ibuprofen here, you give another one, and for these 2, you decided to skip the ibuprofen because they did just fine with Tylenol. That's perfectly fine. And then later you decided to give it again. The every 6 hours is the minimum interval, and when you're staggering these, you can do it any way you want, as long as between 2 doses of the same medicine you give 6 hours at least. Alright, thank you for stopping by today. I hope that these formulas will help you calculate the medicines at home. If you have any questions, please let me know. And if there's another video that you would like to see, leave me a comment, email me, let me know in any way. Thanks again, and we'll see you next time.